Welcome and thanks for joining us. My guest today is John Horowitz, the President and CEO of Easterseals DC, Maryland, Virginia. John, thanks so much for coming on with us today.
Thanks so much for having me.
And we're talking about places in the DC region, whether they be businesses or nonprofits, that really prioritize workplace health, not just physical health, but strong work relationships and psychologically safe environments. Before we get to that, let's talk about Easterseals just for a moment. Tell us what you do.
Well, we are a nonprofit that supports people with disabilities, veterans, and military families to ensure that they are fully participating in the community and have great opportunities to maximize their potential.
So health is something that runs throughout.
Yes, yes.
Okay. When you hear about workplace health, what does that mean to you and your organization? Why is that so important to you?
Well, first of all, because of our mission to care for the community and for the families that we serve, if our employees aren't feeling taken care of, they can't care for others. If you're worried about, how you're going to keep food on the table or whether your own health care is going to create a problem, then you can't be there to support others. Mm-hmm. So we really work to make sure that our staff has good pay and benefits, promotion opportunities. We regularly are benchmarking our benefits against others to make sure that we are providing our employees with what they need.
Mm-hmm. And when you talk about the culture of workplace health, how do you go about promoting that? Some organizations, they really focus on talking about that when they're looking for employees or when they know employees are seeking out new opportunities. Is that something that you really focus on, getting that message out so that people know that about your organization and employees seeking opportunities know that about you?
We try to. I will tell you, as you might expect in the nonprofit world, there's never as many advertising dollars as you'd like. But I think the team has done a great job really highlighting the career opportunities at Easterseals, and we really highlighted on our website, both how we can have good pay and benefits and also good career paths for people. So one of the things I'm very proud of is we work really hard to have great partnerships with colleges and universities in the region.
Okay.
And in many of our programs, such as early education or medical adult day, in order for people to get promoted, they often need another degree or certification. Mm-hmm. And so with these partnerships, we're able to offer classes either for free or at very low cost to our staff. And when they complete certifications or degrees related to their work, they actually get a bonus and they become eligible for promotion.
Okay, so that really keeps everybody together. You're boosting everybody up, right?
Yep.
Okay. How do you create strong relationships between employees and leadership? Because as we just talked about, everybody should be together. It should be a cohesive environment, right? So how do you keep everybody together, everybody in the loop?
Yep. Well, that really starts right from new employee orientation.
Okay.
So we have 11 centers throughout the region, ranging all the way from Hagerstown to Northern Virginia. And as you might imagine, it's hard to make sure that everybody stays in the loop when we're so geographically dispersed. And so all of the employees participate together in new employee orientation to ensure that they have a good sense of the whole of Easterseals and all the different programs, not just their program. And then I'm a part of every new employee orientation. I really work to make sure that everybody understands the core values of the organization and our vision. And then ongoing, I'm out regularly visiting all the centers. So one thing that we do that I think is really special is for all of our employee anniversaries, when somebody's been there more than 10 years, I actually go to their center and celebrate with them.
That's nice.
So usually, a couple times a month, I'm out at our different centers. And we also have a program called the SEAL Squad, where all of our senior leaders every quarter are going out to each center so that they get a sense of what's happening and so that staff can really hear from the leadership team, what's going on, what are we focused on. Especially right now with all the changes, it's very important that staff know that we are watching out. We're not just sort of sitting around waiting for shoes to drop, but rather we're planning and being prepared for things that might happen down the road.
When we talk about psychologically safe environments and mental health in the workplace, it seems like that has really become a priority for many places just in recent years. Maybe if you go back a decade, it wasn't so important, but just in recent years, and especially since COVID, when that had such a profound impact on all of us, it really seems like that's something that is important to organizations, that you feel psychologically safe and that your mental health is cared for in the workplace. Is that about, like, in the recent years it's become more important, you think?
I think so. And, I see that both, from the Easterseals side and also from our donors and corporate volunteers. So one of the things we do, you might know, we have a mental health clinic, the Stephen A. Cohen Military Family Clinic at Easterseals, that provides high quality, evidence-based outpatient mental health care to veterans regardless of their discharge status, active duty service members, and all of their families. And one of the things that we've seen is a big increase in corporate volunteerism. We actually provide every client in that clinic a what we call a mental health first aid kit or a bug out bag that helps people ground themselves if they're spinning or feeling stressed. And so we have corporate volunteers that come and pack those bags. And it's really amazing because every time there's always a clinician there that's part of that, and it really opens up a discussion around workplace mental health. So we're seeing it both on our own staff and out in the community.
If someone approached you and asked for advice, if they had their own organization, their own nonprofit or business or whatever, and they were asking you, how do I improve my organization's workplace health and culture, how do you think you'd describe your advice to them? How would you put it to them so that maybe they could have some ideas or some new form of carrying out their business that they may want to try to implement? How would you describe it to them?
Well, I'd say there's really two things. So one is having a strong culture and clear core values so that everybody understands what's expected. And two is being data driven. And so it's really important to survey your employees, because what works for Easterseals might not work for, company X. So we really spend a lot of time asking our employees what do they care about and what matters to them.
Okay, so you always seek input, in other words. You're always doing that.
Yes.
How often?
Because everything's a trade-off. At the end of the day, there's only so many dollars, and you can put it to benefits, you can put it to pay, you can put it to the 403B match, but you have to, allocate it somewhere.
And that's part of that comprehensive approach you have of always keeping employees in the loop. Do you have a set schedule where you ask and seek that input, or do you just do it on a basis that comes to you in the moment, or do you have a schedule for that?
No, we have a schedule, because we want to make sure that we're tracking regularly and seeing, how are we doing over time on various elements.
Okay, so that's how you keep that data-driven approach going then.
Yeah.
All right. Great, John. Thank you so much for your help today. Really appreciate it.
Thank you.
That is John Horowitz, the president and CEO of Easterseals DC Maryland, Virginia. You're watching the Leadership in Action series. I'm Nick Iannelli. And for more on this discussion, visit WTOP.com and search Kaiser Permanente.